So, welcome to the Navigating Mainstream Benefits training series on SSI and SSDI. Just a quick intro for myself. My name is Sadaka, and I'm from Homebase. We are a nonprofit technical assistance provider. We provide TA for COCs across the nation. We also work closely with the Santa Clara County's Office of Supportive Housing. One of the many things we do in that scope is bring trainings on behalf of OSH, including this Navigating Mainstream Benefit series that we typically hold annually. And just before we get started, we have a few Zoom housekeeping rules. In terms of tech, I know you all are familiar with Zoom by now, but I do want to let you all know that we are recording this training. And since we're recording, all training materials and the recording will be posted to the COC training website, so don't feel like you have to screenshot any slides. We're also going to keep everyone on mute by default, but there will be time at the end to ask questions. In the meantime, please feel free to pop any questions you may have in the chat. And we will make sure to bring up those questions toward the end. And it's going to be places throughout the slide deck that you have time to raise questions and come off mute. And then also, if you have any technical issues, please email us at Santa Clara COC. Oh, sorry. I think I'm saying the wrong one. Oh yeah, Santa Clara COC at homebasecc.org. I will be able to help you come back on Zoom, but you can also directly message us on Zoom as well. It will be me and then my colleague Tanya Morales that you can message directly. And then also just someone let folks know toward the end of today's training, I will also be emailing you all a feedback survey just to provide us some feedback and to help us improve future trainings in this topic area. And then as a quick introduction, our presenter today is Annie Sue Anderson from the Law Foundation of Silicon Valley, and I'll pass the slide deck on to her.
Thank you so much for that introduction. I'm so happy to be here. I've been practicing SSI and SSDI law for about 13 years now, and I've been with Law Foundation for a little bit over 2 years. So hoping to answer questions. If they're too specific as far as now we're getting into client details, I really encourage you to reach out to us. There'll be information on how to contact us, but of course, we'll be monitoring the chat, and there's going to be a natural break a little over halfway where I will pause for questions and give everyone a little bio water break for about 10 to 15 minutes as time allows. So we'll just be monitoring that as well. I'm going to share my screen now for presentation and get started. Everyone see that okay? Nodding is fine too. Okay, so like we said earlier, we're going to be going over Social Security disability insurance and supplemental security income benefits. And just before we begin, a little bit about the Law Foundation of Silicon Valley and what we do. We provide free legal services in 3 subject areas: health, housing, and children and youth. So this presentation is coming from the health program of the Law Foundation of Silicon Valley. Our health practice focuses on providing legal services to people living with physical and mental health disabilities in a variety of practice areas, including mental health patients' rights. That's for folks who are in involuntary commitment hearings and are at hospitals involuntarily. Public benefits, including Social Security, state and local benefits like Medi-Cal, General Assistance, CalFresh, federal student loan discharges, as well as name and gender marker changes fall under our umbrella. Just as a basic roadmap for today's training, relating to Social Security, we'll be going over basic eligibility, including the difference between the 2 programs, SSI and SSDI, how to establish disability or what goes into that, eligibility when you're screening for someone who is an immigrant. And we'll go also into the application and appeals process, including getting started, what the questionnaires look like, common pitfalls, what to do if you receive a consultative exam appointment and what those are for, what the appeals process looks like in these benefits processes, the deadlines and why they're important, as well as continuing disability reviews for folks who are already on SSI or SSDI, but their benefits are being reviewed and potentially being threatened to be cut off. Also, as an aside, before we begin, Social Security has a lot of complex rules that we understand are frustrating and confusing and hard to understand. My job would not exist if Social Security was straightforward and these rules were logical at times. Um, you do not have to memorize all the information we're sharing with you today. Our goal is to give you this information so you can help identify issues when they come up, and so you'll know when to refer clients for help. Bottom line, if your client gets a notice from Social Security that you don't understand, or your client has a problem with their Social Security payments, we are here to help. Interacting with Social Security can be very difficult for everyone, so know that this is for attorneys and legal aid providers, as well as, folks in the just general public who are receiving these benefits. This is unfortunately not something we can fix, but hopefully we can partner with you to get your client's issues resolved. Now we'll dive into basic eligibility for Social Security benefits. There are two types of Social Security benefits, SSI and SSDI. The Social Security Administration, also known as SSA, is a federal agency that administers two different disability programs: Social Security Disability Insurance, also known as SSDI, also known as Title II benefits, and Supplemental Security Income, also known as SSI, and sometimes it's referred to as Title 16 benefits, based off of where in the law the rules can be found. Both programs require the same finding of disability. So when you're looking to apply, it's important to might as well apply for both, because if you are eligible on the medical side for SSI, you'll be eligible medically speaking for SSDI. The difference when it comes to eligibility for these different programs is going to be when they're finding you disabled as well as how much you've paid into the system if you've worked. Some differences here are SSDI requires a sufficient work history in order to be covered by that program. That's why there's the word insurance in SSDI. It's because it's part of a little bit out of your paycheck goes into Social Security, and this is the program that you would fit under if you have a sufficient work history that I'll go more into later. And SSI has income and asset limits because it's a safety net program, and we'll get more into that as well. So relating to SSDI, this is a cash benefit to people who are disabled or blind, who are insured by their contributions through payroll taxes, through FICA. Okay, so that stands for Federal Insurance Contributions Act. And as you work, you pay taxes, you earn credits for Social Security benefits. And if you earn enough credits, then you may be eligible for SSDI. The monthly benefit amount depends on how much you contributed through FICA. So generally speaking, the more you earned in your working life before you became disabled, the higher your SSDI payment amount will be. The maximum SSDI payment amount for someone who's like a very high earner would be $4,152 in 2026. Generally speaking, for the clients that we are providing, services to, we generally see SSDI payments around $1,200 to $1,500 a month. If the earned monthly benefit to which someone is entitled to is less than the payment amount, SSI will be able to make up the difference. So if you, that's why I say make sure someone is applying for both. You just never know what their earnings history is, and potentially they worked, but it wasn't at a high enough rate where they're getting matched up to the minimum that you get on SSI. So if you aren't getting paid um, the minimum SSI rate when you get SSDI, SSI will make you whole. Eligibility for SSDI also depends on how many quarters of earnings a client has over their working lifetime. And after 24 months of being on SSDI beneficiaries automatically start receiving Medicare. So that's a benefit to SSDI. A little bit about SSI, that's Supplemental Security Income. This is cash assistance to those who are aged, meaning 65 and older, blind or disabled, and have limited income and resources. The amount of benefits for which someone is eligible differs, and it's based on a variety of factors. So, like I said earlier, it's a safety net program. You're supposed to not be eligible for any other public benefit program. If you are potentially eligible for other benefit programs, for example, SDI, state disability, SSI will make you go and apply, or unemployment insurance, they will make you go and apply before they allow you to apply for SSI. To be financially eligible, these are the non-medical requirements. An individual must, one, not have a monthly income from other sources more than the maximum SSI amount. And two, you must not have resources exceeding $2,000 a month. And it goes up a little bit for couples. Can't have resources in excess of $3,000. Once you get SSI, you're automatically eligible for Medi-Cal with no share of cost. A little bit about this chart. This chart goes into the maximum SSI benefit you would get if you are a single person in 2026. As you may see in your work, your living situation will affect how much SSI you may receive. So if, for example, you are someone who, has their own apartment and, meets the SSI disability definition and you're paying out of pocket for your own apartment, then you will be receiving $1,233.94 a month. If you have no cooking facilities, that's the third one down. That's someone who is disabled, living alone, and, for example, is in an encampment. California will supplement a little bit, realizing you don't have any cooking facilities and that you need to eat out more. It's not much, but it does go up a little bit to 1,362. So those are just some factors that go into your SSI amount, or how much somebody will receive on SSI.
Annie, just to flag, there was a question clarifying, can someone with mental health diagnosis who has never worked be eligible for SSDI?
No, if they've never worked, they will not be eligible because they were never insured by their program. And if you have questions about it, you can always ask the Social Security office if this person is insured. Or you can come to our office and we can ask for them with their permission and find out more if they're eligible for SSDI. If you're not sure, though, I still recommend applying for both, and the worst you'll hear is no from SSDI. Thank you for flagging the questions because I can't see them. All right, so again, there's two ways you have to meet the program. It's the medical criteria and the non-medical criteria. Now we're going to get into the little bit of the medical criteria. So their definition of being disabled is the inability to do any substantial gainful activity. That's a very specific definition that I'll get into, due to a medically determinable physical or mental impairment that has lasted or can be expected to last for a continuous period of 12 months or more, or result in death. So this is not a temporary disability that we are assessing. We're looking for permanent disabilities, keeping people away from working full time. You have to be unable to do any substantial gainful activity. So if you are working over the amount of 1690 a month, Social Security will disqualify you. You have to not be working at that level, or unable to work at that level to qualify. If you're blind, the work earnings limit goes up a little bit. If you work up to $2,829, for example, you might be eligible. Any questions here? I move on.
No questions here, but someone had a
Okay.
follow-up question. U.S. citizens that have a home in a foreign country, can they also have a SSI?
Uh, what was the first part? U.S. citizens?
Yeah, that have a home in a foreign country.
They might start counting that as a resource. So that is definitely a question you want to consult an attorney about. Good flag though. That's like definitely a time where you'd want to stop and check before they have to go through the whole process. Maybe win on the medical, but then find out after 2 years of that process that they're actually ineligible to begin with because of, having excess resources. All right. So, looking at the five-step evaluation process for disability, this is exactly what the Social Security Administration has to follow when they're determining whether or not someone is disabled. Step one, and it's chronological. So, you start at step one and you go through to step five. Step one, they ask, is the claimant engaged in substantial gainful activity, i.e., are they working at those high enough levels? Um, Remember, it's 1690 per month in 2026. So if they're only making like, $10 because they're greeting someone at the door every so often here and there, likely it won't meet that. So if yes, they're not disabled, they cannot continue. But if no, if they're not working at that level, then you can continue to step two and try and see if you are found disabled. So, and again, this is permanent disability. Step two asks, does the claimant have a severe impairment? If yes, then you get to go to step three. So it's not something like the common cold or the flu. We're going to be talking about like major depression or an amputated leg or, something that's more permanent, not going to go away. If not, obviously you won't be found disabled. The inquiry stops there. But if you are, then you get to proceed to step three. The Social Security Administration then asks, does the claimant have an impairment that meets or equals a listed impairment? If yes, then you're found disabled. So a listed impairment, you can find them online. It's an impairment listed by Social Security as so severe that the judge should find this person disabled. So it's a set of laws that Social Security has deemed to be very disabling, and they usually come up with this criteria in conjunction with doctors. So at step three, the process stops. If you meet this definition, you win. If no, then you proceed to step four. So for example, it might be like 5 hospitalizations within 6 months. That might be with the criteria. I don't think that's one of them, but it could be something like that. And if you don't have those 5 hospitalizations, then you would proceed to step four. It doesn't mean you don't get disability. It just means the inquiry and the evaluation process continues. So looking at the fourth step, Social Security would then ask, well, can this person return to his or her past relevant work? Their past work within like the past 5 years. If they can't, then you keep going. Um, so the next step would be step five. Can the individual do any type of work that exists in significant numbers in the economy? If they cannot do any type of work, not your dream job, but just any type of work, ticket taker at a toll booth for, 8 hours a day, or a secretary, or, anything. If not, you're found disabled and you win. But if Social Security finds that you are able to do any other type of work, then they'll find you not disabled. Going into a little bit about step three, like I was explaining before, it's a listings table provided of examples of conditions that are presumed to be disabling. So the Disability Determination Service, that's who Social Security hires to medically review cases. They'll look at your, hospital records, your clinic records, things like that. And they compare an individual's diagnosis, symptoms, clinical findings, and functional limitations to that criteria. It's kind of like a dictionary of disabling conditions presumed to be disabling. And if medical records show that they meet or they equal a listing, then the patient should be found disabled. It is organized into 14 different body systems, um, including but not limited to mental disorders, for example. So that could be something like PTSD, anxiety or depression, schizophrenia, and then below that, it'll have a bunch of criteria for um, how severe the PTSD needs to be, or how severe the anxiety has to be in order to meet that presumed disabling definition. Another body system that can be found are neurological disorders like traumatic brain injuries, if you've had a really, really bad knock to your head. Epilepsy, for example, can be found there. Musculoskeletal disorders are found in these 14 body systems, things like disorders of the spine or problems with your joints, amputations. And then, another one would be cardiovascular, like chronic health failure, disorders like that. And a little bit about steps 4 and 5 when they're assessing ability to work. They're looking at, can you work based on your residual functional capacity? So, given your disability, what is the most you can do despite your physical and mental limitation? That is what they will consider your residual functional capacity. So, if you, for example, you're limited to only lifting 2 pound, anything over 2 pounds you can't lift, well, then you're probably not going to be working in construction, right? That's not something Social Security could say you can go do. So you're not going to be found able to go back to your construction job if that's all you were doing before you became disabled. Remember, that's step 4. Step 5 is going to ask, can you do any other jobs? Um, Also, going into a little bit on exertional limitations, they're going to be looking at how much you can lift and carry, how long you can stand, walk, sit, whether or not you can hold yourself upright, can you twist? Can you hold, objects in your hand? Are you able to work with small objects if you're doing, something that's like finely skilled, or are you even able to hold a tool, for example? And then non-exertional limitations are limitations on, for example, concentration, limitations on your ability to persist or keep up with a certain pace of work, your ability to interact with peers. Are you limited to working with certain individuals? Are you unable to work with the general public because of, your prior disability, things like that? So those are all going to go into the assessment at steps 4 and 5.
Annie,
Mhm.
questions on this step. Wanting to confirm if for step 4 they say yes, but they work part-time, would that still be eligible?
So when it comes to part-time work, Social Security might stop them at step 1, substantial gainful activity. So it'll be important to look at pay stubs and see how much are they working? Are they earning more than that 1690 a month? So that's really where that comes into play. They might not even get to step 4, but I would say don't give up there. There might be arguments that can be made, and an attorney can look into this as to exceptions. Maybe the supervisor is very, very patient, or maybe it's a sheltered work environment where they know this person has a disability and they're purposely not requiring this specific employee to keep up with a certain pace. If they're giving those kinds of accommodations, there might be an argument to be made that, hey, even though they're making this money, it's not, you shouldn't actually count it as this much, or it shouldn't count at all. So if you have issues with work, rather than telling someone not to do that, I would first consult with um, with our organization or an attorney.
And then the second question, for all of these questions, what if due to client's disability, they cannot remember?
Yeah, that's great. If they can't remember, are you asking like how this plays? Yeah, I might need to know more what the question is. So are you asking for this person, are you asking about like, will it be taken into consideration as part of their disability, or how does somebody overcome that in an application?
Gabriella,
And then I can also continue to take these questions during our break time too.
I think they're asking though based off of they can't remember what job they did.
Oh, interesting. Social Security will also have a earnings record for them. So anything attached to their Social Security number, they will have um, that, and that printout can often help jog someone's mind as to, oh yeah, I did work there or I didn't. So that could be something one could request from Social Security. Hey, can I have a printout of my earnings history? Um, and just as a last point, we're not looking at whether or not the person can do their dream job, but rather any job that will earn them 1690 or more. If the judge finds or Social Security finds that they can, then they will be found not disabled. It's a little bit higher for someone who's blind. Um, this is a really important screen, substance use and their effect on Social Security applications. Please note, clients do not need to be clean and sober to qualify for Social Security benefits. But if a client has an alcohol or substance use disorder, they must show that impairments would still meet that disability criteria, either at step 3 or step 5, even if they're totally sober from alcohol or substances. And well, if someone's using how or currently using, how do you show that? There's a couple ways, and there's some tips here. One thing you'll want to think about is for the person applying, do these problems relating to not being able to work still occur even when the client is sober? Or is it only a problem when they're using? You'll want to document any impairments that predated the substance use, or ones that exist even when the client is sober. So even when they're sober, are they still having memory issues? Are they still unable to get along with others? Are they easily triggered even when they're sober? Or were they harmed in some way before they even started using substances, maybe as a child, or, um, they were on an IEP plan and they were never able to find someone to help them with a specific issue that they were having in school. All those would be really helpful to document and to show that their impairments would still meet certain disability criteria, even if they were completely sober. You're also going to be looking for organic impairments like neurocognitive disorders or traumatic brain injuries, things like trauma and access to disorders like personality disorders. Those do not go away simply because one stops using any substances or alcohol. Trying to go to the next slide. What happened? Okay. Now a little bit about eligibility for immigrants relating to SSDI. Immigrants to the United States are eligible for SSDI. Remember, that's the program that you pay into if you have a work history. And they're eligible for SSDI if they have worked and paid into the Social Security system prior to the onset of their disability. The workers with sufficient work quarters are eligible for SSDI, and for an immigrant to qualify for SSDI, the immigrant must be lawfully present in the US. Lawfully present means they have a valid Social Security number, they've been inspected by DHS, the Department of Homeland Security, and the individual has not violated the terms of admission to the United States. And we'll go into another slide for if this is not the case. Um, Eligibility for immigrants relating to SSI. SSI is typically not available for non-citizens. However, DHS has granted SSI eligibility for the following categories of immigrants. So these are exceptions. The individual was lawfully residing in the U.S. on August 22nd, 1996, and the individual is blind or disabled, or the individual was receiving SSI on August 22nd, 1966, and the individual was lawfully residing in the U.S., or the individual was lawfully admitted for permanent residence under the INA, Immigration and Nationality Act, and the individual has 40 credits of work in the United States. An individual can also use a spouse or parent's work credits to qualify. So these are very limited exceptions. That August 22, 1966 date is the date relating to a law that Congress passed, so that's why it's very specific. These are all things that Social Security will assess, as well as if they come into contact with our office, we will typically assess for this too, because we, of course, want to make sure that folks who are applying are eligible. Relating to a little bit, continuing on with eligibility for SSI for immigrants. Individuals who do not qualify for SSI based on their immigration status, but who are disabled and low income, they should really consider applying for a CAPI, Cash Assistance Program for Immigrants. CAPI is supposed to be like a mirror of what someone would get on SSI. So it's the same medical definition for disability. And on the non-medical side, if you don't meet SSI's criteria, you might be eligible for CAPI. You can apply for CAPI through social services. You can do so online, by phone, as well as in person. So the contact is there for essentially social services, will help you file for CAPI. And then the criteria is the same on the medical side for disability. That's 5-step analysis. We have a couple of poll questions for you, just two, and you could just drop it into the chat. True or false? The Social Security Administration administers two types of disability programs. Both require the same findings of disability. Yeah, I'm seeing a lot of true. And if you marked true, you would be correct. It's the same finding of disability. The medical criteria is the same. It's the non-medical criteria, the work earnings, or are you over-resourced? That's what's going to change about each of the other programs. All right, and I can share out those results too. Good job to those who have answered true. Okay, next question. What are two of the disability programs administered by the Social Security Administration? Is it SSDI and SSR, 2 SSI and SSR, or 3 SSDI and SSI? Awesome. Yes, SSDI and SSI. I think almost everyone um, responded with SSDI and SSI. I know there's a lot of alphabet soup out there. The other confusing one is SDI, State Disability Insurance. So sometimes if someone comes up to you and says, hey, my SDI got cut off, you'll just want to ask, are you talking about Social Security or maybe EDD? Because EDD is the one in charge of the state program. And these are federal benefits that we're talking about today. So that's another way you can distinguish too. Where's that money coming from, state or federal? And I'll share out that result. Good job, everyone. And now I have a little bit of time for questions and maybe a 15-minute break before we come back.
And I can raise some questions in the chat that we
Okay,
received.
great.
One of the questions was, what if they can't remember how much they lifted, stood, or kneeled? What is the proper way of documenting that?
You can just answer what you can on those kinds of questionnaires. So if they can't remember exactly, they can say, I do remember lifting like a ream of printer paper. You can just get really concrete and give specific examples. That way, Social Security has an idea of, oh, okay, they lifted at least 2 pounds, for example. things like that. If they can't remember completely, that's okay. Yeah, just try your best on the questionnaires.
And then also someone asks, what if clients has always worked and is pregnant but can't work and cannot accommodate? So is she out of, and so she's out of work.
Oh,
Um,
okay. That's for those, she should probably apply for maybe like the state program for temporary disability, SDI. If her disability is literally just based on being pregnant, it's not, the Social Security is not going to say that's a 12-month or more disability.
and then the next question is, if they use a spouse credit, how does that affect the spouse?
Oh, that's a really good question too. That is case by case. Usually we can call into Social Security and ask, did their spouse earn enough, or is this going to affect the spouse in any way? Is there a specific concern relating to that? Or is this person just asking generally, seems like?
It's like asking
Yeah.
generally.
That's hard to say. It really is case by case based off of what it is. Yeah, they're trying to do. Hmm.
And then the next question, what sort of documentation do you need for CAPI?
CAPI. I don't know what, I'm not familiar with that acronym. Oh, for CAPI. Sorry. I
Sorry.
thought it was a health insurance program. What kind of documentation is needed?
Yes.
The same kind of medical documentation you would need for SSI and SSDI. So any hospital records, clinic records, jail records. Sometimes they see you in jail for, just regular mental status examinations or physicals. Even jail records can be helpful. Any special education records are helpful. So it's the same medical criteria. So they're going to be looking at the same types of documents.
And then following that, does CAPI affect someone getting USA residency if they are in the process or plan to apply in the future?
That is a really great question. I know that's true for SSI, but to be safe, because there are issues maybe relating to public charge, you can consult with an immigration attorney to see if there's any negative effects of obtaining CAPI for your immigration case. Great question.
And then the last one is, adult children with disability use their parents' work credit to apply for disability
They
benefits?
they might be able to. Yes, it depends on their parents. It depends on their parents' earnings history. Did they pay enough into it to qualify for SSDI?
And then, sorry, one more question that came up around CAPI. For CAPI, do you have to be in the country legally? And folks,
Uh,
yes, but just,
for, for CAPI, do you have to be in the country legally? I don't want to say without looking at the law on that one. I'm not quite sure. I just know that if you're not eligible for SSI, you might be eligible for CAPI. So that's something that you'd want to screen for.
and then follow up is what sort of ID is required for CAPI?
Yeah. So I think same question. I mean, don't quote me on this. I do think you have to be, availing yourself to the government, but because CAPI is run, it's a state program, and it's also you apply at social services. If you're undocumented, they have made promises that, they will keep your identity safe, things like that. So, all really good questions, but I'd have to look into the eligibility criteria for CAPI.
And someone put in the chat, just folks that have a little bit more background, Cynthia put for CAPI must be a resident
There
needs
you go.
consult immigration attorneys if the person has immigration financial sponsor. And Josephine put some links in there too so that folks can check out. And I think this will be our last question, then we can go for the break.
Yeah.
But one more is, do you have to be 65 and plus for CAPI?
No, not at all. You can be younger.
Perfect. So it's 1:41 right now. How much time would you like for the break?
We have time since this training goes till 3. We could take a 15-minute break.
Sounds
So
good.
maybe
So
come back a little bit before,
1:56
yeah,
basically.
1:56. A little bit before 2 o'clock. Okay, see everyone back at 1:56. Okay. Thanks everyone for taking a little break and rejoining again. We will continue on with the presentation and we'll be discussing the application and appeals process next. I know this screen looks a little bit intense as it's very detailed, but just to give you a good idea of where they send the application to and, why it may take a long time, this will be a good summary of what is happening. So, um, you're going to be helping folks apply for Social Security at the Social Security Administration office. They have field offices all throughout, the Bay Area. So you want to go to your local one, or you can call in to file a claim online. At this time, when you go into Social Security, they do not accept walk-in appointments. So if you need assistance filing for Social Security, you can walk in and what they'll do is they'll give you an appointment day and time where they will call you back and help you file over the phone. So that's also something that is a little bit more of a recent change. Previously, you could have just walked in and filed potentially same day. You want to establish a protective filing date too, for Social Security SSI benefits, excuse me. For SSI benefits specifically, it can only go as far back as when you first applied. And so if you apply, at any point in the month of, let's say February 2026, your benefits, even if you had a disability predating that, will only go back to February 2026. So it's really important if you can to help someone establish a protective filing date. If they're not sure whether or not they qualify, err on the side of caution and just send them to apply. Because again, the worst that can happen is Social Security says no. But for every month that passes by, that's another month's worth of benefits that you are missing out on. Also, in order to file and get a protective filing date, the law says that, something in writing that says I intend to file should be enough. So if you can help someone fax a letter to Social Security that says they intend to file, or help them walk it down and turn it in that they intend to file for Social Security, whenever Social Security actually ends up taking that application, they should associate that with the letter that was initially turned in. So that would protect that month's worth of filing. After you complete the application, you're also going to need to fill out something called a disability report. That's a very specific form that is part of having a complete application in Social Security's eyes. Then the file gets sent to Social Security and they determine whether or not someone is eligible on a non-medical basis. Are they a citizen, for example? If they're not, they're going to deny it, and then maybe you want to consider CAPI. But they're going to go over the non-medical criteria for eligibility. And then after that, then they're going to send it on for medical eligibility review. When they do that, they're going to be sending that to a state contracted provider, disability determination services, where a disability analyst is assigned to the case and will essentially send it to medical experts and medical consultants who will review the file. But the disability analyst is the one who is basically the worker of the case on the medical side of things. So sometimes their names and phone numbers are printed on forms, and they're the ones that order the claimant to go to medical appointments, or they say, oh, there's no decision yet, things like that. So that's who you'd want to be in contact with if you want to find out specifically what their medical review, how their medical review is going. Then Disability Determination Services, also known as DDS, processes and makes the disability determination, and then they'll send the file back to the local Social Security office, and then the Social Security office is the one who issues the formal letter that says, we have denied your claim, or um, if they approve it, oftentimes you can't tell. It just says, we we want to meet with you. Please call us within, a certain amount of time. And then when you call, you find out, okay, your claim was approved. So regardless, whenever someone gets mail from Social Security, they should be responding. There are deadlines associated with denials, as some of you may know. So you'll be wanting to respond as soon as possible. And sometimes it could be an approval too. Or sometimes they need more information, and that is something that you'll also want to get back to them on so that your claim is not delayed.
Annie, a question, it looks like a clarifying question. Does SSA assist with completing the application?
Yes, if the initial application, yes, they will. So they'll set an appointment, and then during that appointment, they'll call. So if you need help with that, you should call Social Security. They will make an appointment for the claimant. But again, those that there could be some wait time. There's some lag time between when you call and when you get an appointment for an application. So that's why the protective filing date is really important to try and get for a client. And then, yes, Social Security notifies claimants most of the time by letter, by decisions. They will not call to notify anyone. So if you get any calls that could be a scam, just know that Social Security communicates by paper mail. Always very important to keep them up to date with the claimant's most recent address. Here's the phone number to file a claim online. You can also go to ssa.gov/apply for disability. Like I said, they can also visit their local Social Security office in person. They will set up an appointment interview time. It is best to assist clients with applying if you can. Usually that's online. And ensure that you print the confirmation of submission so you have that proof too, in case Social Security says for some reason or other, oh, we don't see such an application. You'll have that proof in your hand. If you're assisting a client with an application, you do have the option of signing on as the client's authorized representative. We call them ARs. It's not a bad idea for you to sign on as an AR during this application process, especially if your client has trouble receiving mail or responding to mail. Maybe they're not very good with staying on top of all their mail. Because as an AR, you will then receive copies of correspondence so that you can help them stay on top of, appeal deadlines that may come up if Social Security sends a denial, for example. Or also, if DDS sends correspondence, as an AR, they by law have to send you a copy of whatever they're sending the client to. So DDS will be responsible for sending your clients to medical appointments, for a Social Security doctor to review the client in person. So you want to make sure that your client is not missing those, because if they do, then they will say, oh, we're closing the case for failure to cooperate. So if you can, if your organization lets you, signing on as an authorized representative to receive that correspondence is helpful. Just a little bit more about the application process. There's multiple questionnaires that come up during this process. Um, and these are required documents. The disability report, oftentimes it'll say all Social Security forms will have a form number in the bottom left corner. So the disability report form number is 3441BK, for example. SSA 3441BK is what you'll see in the bottom left corner. And it details the client's medical history and current treatment. Or rather, it asks for the details of the client's medical treatment and their current treatment. So it's important to be sure to give accurate information about the places where they're receiving medical care, including the correct addresses, because this is what DDS uses to go get those medical records. So if you don't even list a source, that's a problem too, because then Social Security will say, "Oh, you didn't tell us about that source. We didn't go get it. We didn't review it," and they may be missing, a critical ER record or a critical record from a doctor saying, literally in their clinic notes, this person should apply for disability. Um, so DDS uses the provided clinic contact information to request those medical records, and if it's inaccurate, DDS will not receive those records. There's also the adult function report that you may have seen your clients receive. That's Form 3373BK in the bottom left corner. And they will be asking about the clients, what they do on a day-to-day basis. So they'll be asking about clients' activities of daily living. That's where you see ADLs come into play, and just generally how they're functioning. Because someone with depression can be, high functioning and able to hold down a job, and some just definitely cannot. So that's where they're coming in and saying, okay, for you, how does it affect you? And a good tip is to focus on how things are on their bad days, because those bad days are what are keeping clients from working full time. So when they're asking, okay, what did you do today? You're not going to be, reporting back to Social Security, or you don't want to report back to Social Security, the one good day in the month that they have. You want to state generally on their bad days, this is how it looks. They're in bed, 2 hours a day, or they're sobbing over something that, maybe an average person would not find very triggering, things like that. There's also a third party function report that's Form 3880BK. This is a form that the client should give to a third party that they trust, who knows them and will be able to speak to their disability. That could be you. Case managers, people in the community can fill out this form. Family members can fill out this form. It just should be someone who actually knows about this person's disability, who has witnessed, difficulties that they've been through and what they're like day to day. We also have the work history report that gets sent out after application. So the work history report is Form 3369, and Social Security wants to know, okay, what jobs have you had in the past 5 years? How much did you lift there? How much did you carry there? How much of the time were you interacting with people at that job? Because they're going to also later assess, okay, can you just go back to that past work? Why can't you do that? So that's going to be part of their inquiry. It really goes into the step 4 analysis when they're going through the 5-step process that we discussed in the first half of this presentation. With the work history report, it used to be the past 15 years, they'd want you to delineate all the work, but hopefully with the change in law, it's a little bit less cumbersome to fill out, but you'll just want to, again, focus on things that maybe the client can't do anymore. So, things that were difficult about that job that maybe they were at one time able to do, but they can no longer do, because that's how the report is going to be used to assess, can they go back and do that work? Um, Clients will also be asked to go to consultative exams. Usually we see these being ordered, and consultative exams are the exams where Social Security is assessing with the help of a doctor that they're paying whether or not they can do any work. And usually we see this in cases where Social Security is reviewing the file and they're saying, there's not enough evidence here. Let's get them a one-time examination. And they're not very good examinations either. I'll go into that a little bit too. So if there's insufficient evidence in the record, or maybe a conflict in evidence from treating providers, one provider saying, this seems really disabling, and one saying, oh, this just looks like a mild issue, they'll send it to another person for medical provider for an opinion. Consultative examiners are not treating doctors, so they're not like your primary care physicians. They're literally being paid and contracted with DDS to only assess them for this limited purpose of SSI and SSDI or CAPI. And they provide brief exams. Oftentimes, they don't reflect the real range of a client's impairments. They're only seeing them for I've heard exams on the order of 20 minutes, and they're assessing whether or not they can work after 20 minutes, you know? So it's not really a fair judgment of how someone does over the course of, let's say, a week or a month. Nevertheless, these are mandatory, so it is important to attend, otherwise their case could get closed. If they don't attend the first time, you're generally able to reschedule and ask for it to get rescheduled. But if you don't show up to the second time, it could get denied, and then um, you'd have to appeal to the second level. It just ushers you through the program without really getting a fair shot of someone reviewing your records. DDS sends these notices for examinations by mail. So it's really important to, again, keep your mailing address updated with Social Security. If you move, make sure, or your client moves, make sure you're updating Social Security about that move. And then, like I said, if you need to reschedule, call the number listed. The number listed is going to be that analyst that you're going to be touching base with at DDS to reschedule the examination. Any questions so far?
Yes, so we have a few. One of the questions was, we work with members who become incarcerated and after 30 days, their SSI benefits are typically suspended. We
Mhm.
understand that reinstatement requires verification of custody release letter. What is the most effective way to obtain this letter, and are we able to request it directly through your agency, or must it come from the correctional facility?
You'd want to have someone who has access to the custody records. So if we were to help, we would request it from like, Elmwood, for example, or we would request it from the jail itself. They usually have in and out dates. So you would want to get a release, and then you would go to their records department and ask for that. And sometimes if you ask them, oh, we just want the in and out dates, they can process it faster and get that to you too. Hmm.
And then it was a question too, on the application process around questionnaire. What if a client was incarcerated and has no work history?
No work history? Is that what?
That was the
Sorry.
question. Yeah, no work.
Okay. Yeah, then they might be eligible for SSI as opposed to SSDI. Okay, another poll question. How can clients start an application for SSDI and or SSI? Can they call the National Social Security Office phone line? Can they file a claim online? Can they visit a local Social Security office in person? Or all of the above? Yeah, most of you are saying all the above, which would be true. You can do it any of those ways, although reminder of what I said earlier, if you visit a Social Security office, they will request that you come, that you make an appointment. So basically, you're visiting to make or a phone appointment with Social Security. So just know to expect that. They're only doing phone appointments for applications at this time. So I'll end the poll. Good job, everyone. Go to the next question. What is the appeal level immediately following the reconsideration stage? Does anyone know? This is going to lead into our next slide, actually. So if you know, just take a guess. After someone gets denied at that second stage, there's the initial stage or reconsideration stage. Does anyone know what happens next? Ooh, this is really good. This is really helpful for me to see. So appeals council is an option, administrative law judge hearing, and district court. These are all at play with Social Security, and actually what would be next, and only a third of you chose this option, it'd be the administrative law judge hearing. After administrative law judge, if you did get denied there, then you go to appeals council. If you get denied there, then you go to federal district court. All right, we're going to get into that right now. So this is good. So oftentimes, you'll hear of people getting denied and they'll want to know what stage they're at or am I going to see a judge yet? The first time someone will get to talk to a human and say, "This is why I think I'm disabled," and someone should be listening and understanding at least their argument for why. They may not agree, but at least listening, having their day in court is actually with the administrative law judge. Okay, so because up until this point, the only person they've seen potentially is the medical consultant, that one-time brief exam with someone who is a doctor paid by Social Security at the initial reconsideration stage. Just to go into how long this process can take, right now we're seeing that the initial and reconsideration stage to get a decision back from the reconsideration, that total amount of time takes about a year. And then when you file for an appeal and you say, I disagree with that denial at the reconsideration stage, I want a hearing. From the day that you file for that hearing to the day that you see the judge, that's another year. So this whole time, it's really important to be going to the doctor, building up your case, making sure that you're telling your providers what is wrong and not letting that time go to waste. So that when you get before an administrative law judge, hopefully there's enough evidence to approve your case and you don't have to keep going. If you get denied by an administrative law judge, then you can file for an appeal at appeals council. That too can take another year. Generally, appeals council rubber stamps what the administrative law judge did, unless there's something egregious, because this is all the same agency. It's all under Social Security. If you disagree with the appeals council, then for the first time, you have the opportunity to leave Social Security and go to federal district court. That's just like a normal court where a judge will, not paid by Social Security, is going to review the decisions made by Social Security. And that can take a long time as well. So, all that is to say, people often give up. What you do is really important. You're keeping people motivated, you're giving them hope, you're helping them through this process, making sure, they're staying on top of their mail. There's a lot that can be done here to advocate in the in-between. Any questions about this slide before I go to the next?
Yes, one question is, how does one request to the hearing?
So when you get the denial in the mail, it always comes in the mail, the denial at the reconsideration stage, it will tell you how to do it. The best and easiest way is to do it online. I find that Social Security loses it less if you file it internally on the system. You get the printout saying, your appeal has been filed, and then you just keep that as your proof in case, somehow, some way it gets lost in their internal system. Sometimes the online system blocks somebody if they see, oh, you have another appeal pending, or your Social Security is not matching your name, things like that. Then you can file it on paper. You can either walk it down or you can fax it, but those to me are not as efficient. So if you can online, that's the best option. It's on ssa.gov. There's an appeal button, and that'll be also explained. If you call our office too, we can navigate you there. But online is the best. And then if you can't, via paper, and then you can submit it by fax or you turn it in person. Either way, you want to get receipts though. You want to get a fax confirmation, or you want to get, if you're turning it in person, you'd want to get Social Security to stamp it and say, yes, we received this today, and here's a copy for your records.
And then another question, I think it's more of a confirmation, but between stages 2 and 3, are you not eligible for an attorney?
You mean at reconsideration?
I believe so.
Or, yeah. Yeah. At reconsideration, it depends. A lot of private attorneys might sign on, and other organizations may sign on. At this time, Law Foundation is so impacted that, unless there's a very, very good reason, we usually are saying, get your ducks in a row, keep going to your doctors, get these questionnaires filled out by your doctors if you can. And we have questionnaires that we can provide that doctors are able to fill out that are helpful in summarizing someone's disability, and it's very tailored to like the listings and step 4 and 5 questions. But generally, we're helping at the administrative law judge level. Mhm. And I think that's where your advocacy can come into play too. Like if you help somebody write a letter at the reconsideration stage, that could go really far, or even at the initial stage, that could go far. Um, but it's just up to the individual attorney or advocacy group. Okay, so going into the deadlines when you receive a denial, if a client's application is denied, just know that Social Security will send a notice in the mail. Deadlines for Social Security eligibility appeals are always 65 days. So they give you 60 days and then 5 days for mailing. So the time for you to receive the mail as well. So you're going to count from the date that's on the notice. So, in the top corner, there will be a date on the notice, and then you're adding 65 days to know, hey, we absolutely have to file by this date. Again, it's best to file the appeal online if you can. And then if you have to go in person, make sure it gets date stamped as proof that you did submit it. If a client misses their appeal deadline, there are exceptions for good reasons, also called good cause. So these are examples like they have difficulty receiving mail because they're homeless or they were hospitalized, so they just didn't have time to deal with this, or they have a mental disability causing them, to not be able to focus or understand what this letter actually meant, even though they did receive it, things like that. So if your client needs to file the appeal late, you already know it's past 65 days, then you can refer them to our office and we can help them with a good cause appeal. That I would recommend an attorney to help with. Any questions so far?
Yes, so we have a few. One of the questions is they're kind of together. When are you eligible for a Social Security attorney? And then the next one, is
Mhm.
it legal for the private attorney to assist with the application process?
Yeah, that's going to be between the individual attorney, whether or not they are open to filing applications to answer the second question. And then you can have an attorney at any stage. An attorney could be helpful at any stage. It just depends on whether or not an attorney is willing to take on a case at that point. Usually at the initial stage, I'm not seeing a lot of attorneys help here because there's no legal issue yet. Potentially Social Security could approve the case, so attorneys are getting more involved when, someone's finally saying no. And reconsideration, well, there's just so many people that need help at the hearing level too that I think a lot of them are getting pulled. But I think maybe the private attorney pool has more time potentially for the reconsideration stage as well. Mhm.
And then one more question. Benjamin shared in many cases, Medi-Cal is also suspended during incarceration, even
Okay.
after the verification of custody release to SSI. Medi-Cal system sometimes continues to show the member as incarcerated. What steps can we take to reconcile this discrepancy and ensure that both SSI and Medi-Cal are properly reinstated in a timely manner?
Yeah, so Social Security local offices often have to ping an outside, I think it's Department DHCS, in order for their Medi-Cal to be reflected in the system as on. I think it's just a matter of the two agencies communicating. So I think a call to Social Security is always warranted in that state of, hey, this person's back on SSI, they have SSI linked Medi-Cal. Can you make sure you're communicating with the proper agency to turn that on? So I'd call the local office and follow up. And if you can, document it. If they're not following up, if they're not helping you once you call, then start sending faxes, being like, remember our call, and just staying on top of them so that, this is my third call, this is my fourth fax, just continuing to document that, I think helps them escalate the issue too.
And then one more question.
Mhm.
If a client spouse receives SSI, does this count as them having resources?
Yeah, we're going to get into SSI deeming. I think that's tomorrow.
Yeah, I think
So they will reduce Yeah, if your partner gets SSI and you get SSI, they do penalize you because the law is not good in that way for they expect the spouse to support you. And so yeah, you will get deemed with your spouse's resources, even if they're not on SSI. And that will be for tomorrow. So stay tuned. Okay, so going into CDRs, also called continuing disability reviews, some of your clients may receive mail saying, hey, you have a one-time appointment with one of our doctors. That is, and they've been on SSI for, a little bit of time. That is your signal to yourself that, oh, your case is coming up for review again. They're trying to say that maybe you're not disabled anymore. Because some people do improve. They may say, okay, you are in this bucket of people whose medical condition has improved. Social Security conducts CDR reviews approximately every 3 years. It could be less. It just depends on a couple of factors, like, for example, what the judge said in their decision when they first approved you, or what DDS found, if you didn't get to hearing what DDS said in the file, things like that. It may be more frequent if a disability is expected to improve or they see your earnings record. You're starting to earn some money, you're on SSI, but you're working close to that SGA level. They may say, we need to review this case. Social Security will also notify you by mail that they're reviewing your disability. So, the first flag will be a new questionnaire, similar to the disability report or the function report, where they want to know what your day-to-day is like. And again, you'll want to talk about the bad days and the days that are keeping you from working full time or your client full time. And then another flag is, oh, you're being sent for one of those examinations. And for CDRs, you also have the ability to file an appeal at reconsideration, bringing you to the reconsideration stage. And then you also have an opportunity for a hearing as well. And after that, then it moves on similarly to appeals counsel and district court. If Social Security determines that a client's disability has ended, it will send a written notice of disability cessation. Very important. This is like the shortest timeline now in everything I'm going to be reviewing. To appeal and continue to receive benefits for this scenario, you have to appeal within 15 days. That's 10 days and 5 for mailing. So do everything possible to help them submit that appeal within 15 days, because after that, they could say, fine, you don't agree with us, but we're still going to cut off the benefits while we decide. But if you get that appeal in within 15 days, then they'll at least keep the benefits going while they review the disability. Does that make sense? Okay. Good cause for late filing is allowed, but again, it could result in a lapse in benefits. You can refer them to us if your client needs help with filing a late appeal. And when you do refer them to us, if there's something like a imminent deadline, please let us know too, so we can try and get back to the client as quick as possible so that they're not having a lapse in their benefits. Um, Otherwise, the normal deadline to appeal and say, hey, we disagree with your medical finding, it's 65 days. But to keep that benefit going, you have to file within 15 days. Okay. So we often get, these are just some general questions we get. So I'm going to go over them and try to answer them. And then we're getting close to being done. So I can also take questions too. Um, some concerns we usually get are, should the client apply for SSDI, SSI, or both? I always say apply for both, right? Like, even if you're kind of creating more work for Social Security, you just never know their particular circumstances, their non-medical circumstances, such that they might be eligible. So to Social Security, I would say apply for both. Sometimes Social Security will say, nope, we won't. We don't see any history of work where there's no way they're eligible for SSDI, but then at least you know. I would never affirmatively tell them, oh, don't apply for this program or that. Like, I would just say, go apply for both, and then you can hear it directly from Social Security and then appeal if you disagree with anything. But at least give them the chance to hear back from Social Security what their stance is. A question we often get from providers is, should we screen applicants for initial eligibility given the length and complexity of the application process? I think that that's maybe a question, oops, sorry, that's maybe a question for the organization. Obviously there's some benefit to screening whether or not, they're not going to be eligible and they should apply for CAPI like that. But if it's like how severe is their disability, if it's that kind of question, I think, people deserve the chance to hear back from Social Security. And if they really feel that they're not able to work full time, then yeah, even if they're working part time right now, they should apply and hear from Social Security directly. So I would not encourage screening in that sense. But again, that's organization specific as far as how much bandwidth do you have. Um, how do I know when a client's disability began? Clients will tell you. I mean, if you ask them a couple questions, they'll tell you, "Hey, I really couldn't work after this date because I had a really bad accident on May 5th, 2020." Or they'll tell you, I'm not sure, but it was around, 1999 when, I had a really traumatic incarceration, for example. So usually clients know when their disability began, and I always just put down the farthest back date that I can put down because you can always amend the disability date to something later if they need to at hearing. But I always try and give them the benefit of doubt and go as far back as possible. And then when we get into the records and what date is actually supported, that's when potentially I could help someone amend their disability date. How far back should I request medical records? If you're helping someone request medical records and submit it to Social Security, I think it depends on when their disability began, right? Like if they had like a really bad accident and those records still exist, I would try and go get the records contemporaneous to that accident. But generally speaking, if you go back about a year before the onset date, you should be okay. Or sorry, before the application date, you should be okay for SSI purposes. And then again, for SSDI, it's just as far back as you can. And um, yeah, the hospitals are only required and medical providers are only required to keep it for 7 years. So trying to go back too far may not even exist, but I always just try. Next question is, how will a client know if their SSDI, SSI application has been approved? You'll get a letter. If you are not sure or you're like, oh, my client's address has changed a lot, maybe Social Security sent it to an old address, you can always call Social Security too and ask to check the status of their application. They'll likely want to hear from the client or have the client on the phone with you because they won't answer questions about the client without, their permission, but you could call and ask about the status too. But generally when it's approved or even denied, they'll send you mail. You won't get a phone call or anything like that. And how should you navigate large amounts of back pay if a client wins on appeal or after a hearing? With SSI, there is a $2,000 resource limit. So we do advise clients to spend their back pay down when they get it. You don't have to spend it down all the way, but if you have, $2,000 or more in the bank, um, you won't get your benefit for that month, your SSI benefit for that month. If it's SSDI, your large back pay will have no effect on your SSDI. You can have SSDI every month, even if you have your back pay saved. It's really not a good rule. It prevents, saving large amounts, but I think their thought process is that it should be a safety net program. You should be using it for food and housing. So if you have a bunch saved up, then maybe you don't need it. Again, not very logical, but that's their reasoning. In conclusion, and I'm happy to stay on and answer questions, how to refer clients to the Law Foundation we have multiple ways to refer clients. You can fax a referral form to us, our number's there. You can email a referral form to our health intake email. It's healthintake@lawfoundation.org. If you go online to our website, we also have an online referral portal that you can submit a referral request to. They can call our intake line. You can walk into our office Tuesdays and Thursdays from 1 to 3. It's limited hours, but they can still walk in if they'd like. And we're also staffing in person. If your client is a member at VHHP Lexington Clinic, they can sign up and see us in person there too. Other than that, that's it for today. I'm gonna stay online and answer any other questions. And yeah, thank you so much.
Yeah, we have about four other questions in the chat. One of the questions is if a member has a representative payee who appears to be mismanaging SSI funds, particularly when the payee is unwilling to release funds needed to secure housing, and the payee does not agree to transfer payee-ship to a third-party payee such as BMC, what actions can we take? Who should this be reported to? And what is the formal process for addressing payee misuse or requesting a pay review or change?
Yeah. So first off, there is a form that exists if a doctor will sign off on it. So this is an MD, a PsyD, if it's mental health, or a PhD, that can say, if they agree, they can say that this person does not need a rep payee at all. So there's that route. Or you could try and get their rep payee switched. They would need to go to Social Security and, explain why they want it switched, and the rep payee, yeah, would get to be switched. Sorry, I didn't catch the part about a third party. They can't switch to BMC, for example. Or
Yes.
is there any particular reason why they don't want a third party
The
um,
pay
pay?
agree to transfer, it's saying.
Oh, it's not in the payee's decision. That's not the payee's decision. It's the claimant's uh, decision. So yeah, I think you submit a form or put a request in to Social Security. Yeah,
And
that's not the
then
payee's call.
and then the next question is, I heard from a client that he did not receive his Social Security benefits in the last 3 months. Have you heard anything like this? How does this client deal with that rent payment?
Oh, that's a great question. I hear that all the time. That's like one of the major factors. Like, why is my Social Security stopped? So you can refer them to our organization. We can, with their permission, call Social Security and find out why their rent has or their Social Security has stopped. That could be a warning flag that, like, hey, we sent you a letter and you never responded. Like they're re doing the CDR review, or maybe they think the client is over-resourced, something like that. So it's a good red flag to call Social Security and find out what's going on with their case, um, in order to get back into pay so that they can afford rent.
And then the next question is, what do you do if the client can't remember the doctor's information and the doctor has passed away?
Oh, that's okay. If you can try to help them figure out which clinic it was, that's most important, right? It's the medical records that we're trying to obtain, and that lives with the clinic, not necessarily the doctor, especially if they've passed away. And so, oftentimes I'll just even get on Google Maps and be like, do you remember the cross streets or what it was next to? And usually we can identify together, oh, is that clinic there? And then, I can call the clinic and say, hey, what's the fax number for your medical records? So that I can request, the last 7 years worth of records for this client.
And then the next question, if a client is chronically incarcerated in and out of incarceration for multiple years and their mental health symptoms impairs them from reinstating their benefits for the past 3 to 5 years, what do we need to do to reinstate those benefits?
Oh, that's a case specific question. There's a rule that if they've been out of pay for over a year, they have to reapply. So it kind of depends on how long they've been out of pay, where there's some parts where they were able to get back into pay. If there were, that's great. Maybe there's a way we could just get it turned back on. But yeah, definitely that would be a good case to refer to our organization. Maybe we can help them individually.
And then another question, can a spouse who hasn't worked get SSI benefits from the working spouse?
Potentially, yes. That they can get benefits on their spouse's SSDI.
And that was all the questions in the chat, but wanted to, if anyone feels comfortable coming off mute and want to ask any additional questions, please feel free to do so. Yes, Mike. See if you can unmute.
I'm not coming off of mute. There we are. The question is, if you are receiving benefits and you went through a program through SSI or SSDI, if you went through the program to go back to work program or anything like that,
Hmm.
you did not receive any information or training on what that program was about. They just put you in this program. You went, found a job, and now they're saying that you were overpaid during those programs. You earned too much money in the work that you were doing. So they deduct that. Now you're owing a part of your benefits back to them for the work that you did. Is that something that you can get over, or I mean, how is that usually looked at?
Yeah, there's a couple different things I'd want to know from Social Security what the basis of their overpayment is. Is it that you didn't report the earnings and then so as such they kept paying you? Or is it that um, now they're reviewing your medical disability and they don't think you're disabled anymore?
They're saying they
Um,
overpaid you. They're saying that during the 9 months that you were in this program,
uh-huh.
the money that you had made was was more than you should have made, basically.
Yeah.
And so
Yeah, there.
therefore, during that
Mhm.
program, they're
There's ways that I'd refer them to our organization. There's ways that you can, one, disagree, so file a reconsideration as well as file a waiver. So even if you're right and I did all that and admitting to all that, I still should not have to pay back the overpayment. There's things called a waiver request. So
okay.
I would, yeah, refer that person to our office.
Perfect. I'll do that. Thank you.
Hmm. I see one in the chat. I'm off sharing so I can see Yolanda's question. I have a client that has been denied many times. He has appealed many times and just again in December was denied again. Is there anything that can be done? Yeah, so with that person, yeah, I think that helping them advocate and maybe sending a referral to our office too, or a legal aid organization, or even private attorneys, maybe we could see if there's anything that can be done. Um, Denied again at the ALJ at the administrative law level. Yeah. Yeah, I'd for sure help them appeal and then try to find them representation, I think is what I would do. Sophia, for those who need to apply for a CAPI, make sure that members need to apply for SSI yeah, yeah. Oh, yeah, you do need a SSI denial for CAPI to continue to process your application. All right, any other questions? Anyone else want to come off camera? All right, thank you so much, everyone. I'll see you tomorrow for part two. Oh, I see Van has raised his hand. Go ahead.
Let me. Oh, hello. Yes, I have a participant. He applied in July with his lawyers,
Mhm.
and then uh recently he was requested by SSA office to turn in his medical record. Uh, and but he could not find it. He could not get it together. So how can we help him to get his medical record to submit to?
And you said the client has an attorney?
Yes, but his attorney is somewhere in Auckland and they wouldn't help him. It's just so yes, and he have a lot going on, and I started his case manager later on, so I didn't know about this
Ah.
until after. So he gave me the number of this person to contact for medical record,
Mhm.
but I
Mhm.
don't know if I can just call them, to get it for him because I believe
Yeah.
that they wouldn't give it to me because of medical record.
Yeah. Well, I would be careful if they're represented by someone,
Mm-hmm.
now you're doing. you might be in conflict with what they're doing. And if they're
Yeah,
not
some
doing anything, if they're like an SSI mill, they're like abusive, then I
mhm.
would tell the client to, maybe consider switching to someone else that
Switching it's so they will have to start all over again,
no, no,
or
no, switch
how they do
attorney.
that.
Switch
So
attorney. You can hire a different attorney if they're not
so
helping you.
can they just drop them and then refer to you guys,
I
continue to
wouldn't
help them?
drop them. I would first try to get them in contact with the attorney and then try and find a new attorney before you fire the old attorney. You know what I mean?
So this is their job to get the medical record for the client. Okay,
If
so
they're
I'll,
getting
I'll
paid and yeah, because
okay.
the attorney's going to get paid from their back pay. We don't take any fees. We're a nonprofit.
Yeah, I know
But if
that.
if they're private, they're going
So
to get
my
paid.
question is, so
Mhm.
he should just contact them and tell them to get to have them get the medical record. If they
Absolutely.
don't do that, and then his next step will be drop them. How does he drop them?
His next step would not be to drop them. I would just try to find one first. Because if he
Mhm.
drops them and has nobody,
Yeah.
that's not good
Okay. All
either.
right.
So find someone and then
Can he fight you?
we might not have the capacity. We might, but I
Hmm.
just don't want to overpromise. But yeah, you could
Okay.
refer him to our organization, and we can see if we can help
So
him,
did
or
he
we
have
might.
to like drop them by with writing, or how he?
Eventually, yes, it would be in writing.
Okay. So I'm gonna call
But
him, tell him.
I would not fire anyone yet. Just like let them try to work it out first.
Okay, so that there, so you because he gave me the number and he asked me to call them, but I say I don't know if they will let me to get access. And then somebody told him that they will send it to him through like QR code so he can scan it and I don't
Hmm.
know, but why? I mean, if you have a lawyer, why would they do that to him? I mean, he have no computer, he have no access to anything, so he very
Exactly.
frustrated, and then I don't know how to help him.
Yeah. So if they're not going to help him, then that's a very big warning flag that maybe they're not reputable.
Yeah.
And
Yes.
that maybe he should try and find maybe a nonprofit legal
Okay.
aid.
Okay.
Hmm.
Like you. Okay. All right.
Yeah.
So yeah, it just I'm just so frustrated with his case, and then I don't know how to help him further. So any
Yeah.
another one is he haven't been to any doctor. If he go to like doctor to get it, he wouldn't know where who
He
to
doesn't
go
know where to
to.
go.
Yeah. He just he haven't seen any doctor. He doesn't have any because he was homeless. So.
Yeah. Maybe he should try VHHP Alexian. And we staff that one. We're there the last Fridays of the month
So, what he go there for? To get his
for medical care.
for
Right? He's
medical
been,
care, and then he would start all over again. I mean, right? Because he worked before for UPS, and then he got hurt. So
yeah.
he went on a
He
worker
doesn't have to
comp.
start all over again.
Okay.
He wouldn't have to start all over again. No, he would just go for medical care. You're saying somebody hasn't been going to their doctors, right?
Yeah, yeah. But I mean, like I asked him if he can contact his doctor to get the medical record or whatever, and he said that he had no, it's been a long time. He
Yeah,
no
so he should
longer.
start to go. He should start to go as soon as possible to a
Just,
doctor.
okay, so just okay, so Dr. Clinic. Okay, all right. I will talk to
Yeah.
him, and then I will reach out for more questions.
Sure.
Okay. Oh yeah, yeah. Another one.
Oh, let's let someone else who's been waiting and then we can come
Okay,
back to
sorry.
you.
Okay.
Nancy, did you have a question? Or Natalie? You
Yeah,
wanna?
sorry, it wasn't a muting. Sorry. So I have a quick question. Do you guys also help with minors? Like, for example, my clients' kids or something like that with
For SSI and SSDI?
yes.
Potentially, yeah, we could do. I
Potentially?
think if we have the bandwidth, we have the ability to do child claims.
Okay.
But it's bandwidth. That's our issue. Like there's so many people who need help and have hearings, so that I just never want to overpromise. But you can always send them to us. If we can't help, then we'll provide good referrals.
Okay, perfect. Okay, because I do have like two clients whose
Yeah.
kids are minors and I wasn't sure if
Yeah, we have an online form that might be the easiest way for you all here in this room to do that. You can do an
okay.
online form.
Is can you send the online form,
Yeah,
please?
yeah, I'll link it right now.
All right, thank you. Thank you so
Mhm.
much. That was my question.
Of
Thank you.
course, of course. Anyone else? I think there was another person here. Annabelle? No? Okay, maybe. Okay, did you have a question again? I can come back to you, Van.
Yes. So I have a participant. He recently get on SSA, Social Security. He turned 62, and they give him only $46 for SSI, but they request him, like how restrict with his bank account. He cannot put $2,000 in there, more than
Okay.
$2,000. But once a year he get the insurance payout, a lump sum once a year of over $5,000. He cannot like do anything with it. He have to cash it out and then put it away. He doesn't have, the mean to keep it. So, and then $46 for SSI, they requested him for like all the paperwork to submit it.
Yeah.
So I'm thinking if we drop SSI, would it affect his medical? Because his income total only for SSA, and that insurance we divided in 12 months, it totaled $1,207. So
Okay, Van, can I ask you to fill out the form online? Since it's
okay.
so specific, now we're getting into dollar figures and things like that.
Okay, all right,
If you
okay.
put it into the thing, I can assess it,
Okay, right
my
here.
team can look at it more carefully. Yeah.
Okay, all right.
I just don't want to give you wrong advice.
Okay, all right.
Okay. Yes, the slides are going to be emailed out, right? Thank you. I appreciate that. Any other questions?